So today I have the pleasure of talking to Ms. Carranza. So we did her airway work. We started with a sleep study. We did some expansion, myofunctional therapy, and a tongue tie release. Ms. Carranza, I'd like to ask you what were some of the things that you were struggling with before we started your airway treatment, and what changes have you noticed now after we've done the tongue tie release and most of the steps in the process?
Hi, doctor. Thank you so much, Dr. Milka. So before I came to your practice, I did not even know that I had mild sleep apnea. But he
Yes,
explained some of the symptoms I was having, waking up feeling exhausted, not getting enough rest at night, and I knew I was mouth breathing. And then
yes,
in addition, I was also seeing a chiropractor, and I saw one for a while, like used to be once a month. And then I met another couple that were doing like a more holistic approach, and I saw them like almost every day for several weeks, and then from there was like for maintenance. But every
yes,
time, like within a couple of days, I would default back because I have like a lean towards the left, and I had to like keep straightening my pelvis, and so I had no idea that all those were related to having a tongue tie until I met you, and you
yes,
explained about the tongue tie, the tongue release, the whole frenectomy procedure. And then now, since then, a couple of weeks, almost a month now since the procedure, I'm
yes,
able to sleep better. I can feel my tongue goes natural in the rest position that we're supposed to go. I'm getting asleep. And also, I went to the chiropractor, and normally during the adjustments, it's like a series of adjustments. There's a machine, there's the folding, and the neck, which is kind of scary, the neck
yes.
stretches. But this time around, it was like quick, no neck stretches, no hard anything. It was just a simple raise your leg, adjust the pelvis, and I was done.
That's awesome.
Yes,
That's amazing.
yes.
What changes have you noticed in your sleep before doing all this work and now?
Sleep wise, before I was like, I knew I was mouth breathing because I would wake up and then I would feel not rested. Like I felt, even when I slept, I felt like I had not rested enough.
Hmm.
Yeah. This time I feel like when I'm resting, even if it's not as many hours, I feel rested, and I'm able. My smartwatch is telling me I'm getting enough rest,
That's
so I can
good.
tell the difference.
That's
I'm not
awesome.
mouth breathing,
That's
and that I can,
amazing.
and I know when I wake up, I can sense, and I feel like so much better, health wise as
That's
a
great.
result. Yeah.
That's great.
Yeah.
Any changes in your energy levels?
Energy levels, not yet. I mean, it was the holidays, so it was kind of crazy with the holidays and stuff. But hopefully this year, and my work is usually a lot, but I'm
Yes,
hoping that will improve. Hopefully,
that's awesome. Well,
yeah.
we're so happy for all the
Yes.
progress you've made, and thank you so much for your testimony.
Thank you, Doctor.
Yes.